Well, welcome everybody. So I thought long and hard about what I wanted to say. And those of you that know me know several things about me. One is, yes, I do have a warped sense of humor. I like my sense of humor. And I always strive to speak from the heart. I also know that when I get up in front of a big crowd, I get somewhat nervous. So, they can't hear me? No. Oh, I'm sorry. Is that better? Okay, I'm sorry. What I was saying was, I am the type of person that when I get up in front of a crowd, I get nervous about speaking. So there's this old technique that every speaker hears, that when you get up in front of a large group of people, you're supposed to picture them in their underwear, and that makes the speaker more comfortable. And through some circumstances, which I will explain, and me thinking about this all through the day, because this could backfire, and I don't know. It really could, and I could sort of cower and be walking out of here feeling like an idiot. But this organization is for all of you as patients and all of you as caregivers and all the families of the patients. And I am blown away by the work that Sandy and Kathy have put into this. I wouldn't know where to start. I wouldn't have a clue. But they did it. And they've got a lot of good people behind them that help them bring this to fruition. And I'm very proud to be part of this tonight, because I think this is critically important. So, that's my way of saying that, again, this is for all of you. So my funny story. It's not to put me at ease. It's to put all of you at ease. Because in cancer, we often talk about a lot of very serious things. And the mood can go down quickly. My wife developed a fever last night. She didn't get her flu shot this year. I didn't know that. Today wasn't the day to give her hell about it. When she gets better, I will, and she will get a flu shot next year. So she didn't go to work today. So we got up, and of course, it's dark early in the morning, and I'm trying to be very respectful, let her sleep, so I get my shower, and then I come out in the bedroom, and I'm getting dressed in the dark, next to pitch black. And you all know what that's like sometimes. Can't tell a black sock from a navy sock. So I'm digging through the drawers, and I think to myself, oh my God, the only pair of underwear I can see are my white underwear boxers with Mickey Mouse on them. So, this is true. And just to show you how humble I can be, you can all picture me standing here in Mickey Mouse boxers. It's true. It's not one big Mickey, by the way. It's lots of little Mickeys. So just to help you focus. And I'm sorry if I offended anyone, but I told you I have a bit of a warped sense of humor. And sometimes you need humor in this field. But anyway, let me just go through some of my slides, and I'll come back to some other concepts in just a little bit. And maybe sometimes the benefit of support groups is not that obvious, but you know, a lot of people, we all come from different walks of life, different education, different backgrounds. And I know that there's a lot of times when I'm talking with a patient that as best as I try to distill all the information down into layman's terms as best I can, I probably don't hit the mark. I probably slip and I use vocabulary that's medical jargon that a lot of people don't understand. So a lot of people, when they attend support groups, and this has been studied, by the way, this is a study, even though it's published a while ago, this was a big trial involving several hundred patients, lots of questionnaires, really looking at the difference between patients who go to support groups and those who don't. And on the whole, those who do come away feeling better about the knowledge that they have for themselves about their disease and their treatment, better emotional scores, quality of life, coping skills. A lot of times reduce treatment-related, disease-related, and condition symptoms. And that may just be a function of the sharing that goes on in a support group. You know, one patient is going to one doctor, or another patient's going to another, and they get together and say, hey, well, my doctor told me to do this, or the infusion nurse told me to do this, and people can compare notes and pick up lots of good tips and tricks. I sometimes even learn that way. And also, when people feel that they're supported, they tend to be more compliant with their treatment. And that can lead to better outcomes also. A group is not right for everyone. There are some individuals that are more private, and the dynamic of sharing in a group may not be right for them, but a lot of people, they have a better sense of well-being when they're able to just commune with those who are going through the same sort of thing that they're going through. And if I slip with the microphone and drift down, please let me know. And sometimes a lot of people find that support groups are a good forum to discuss things that they wouldn't talk about with their family because they don't want to be a burden or for whatever reason have you. So sometimes it might be a good format to talk about those things that they wouldn't otherwise have an opportunity to. And of course, as I mentioned before, there's a lot of exchange of practical information. And I think a lot of people that go to groups and share have something to offer to everyone. I've been to different support groups, and I think when new patients first come, a lot tend to just come just to listen, and then as time goes on, they are able to open up and share and offer more and more. And I think for everyone, that sense of giving back is very incredible. And that's another benefit to the support groups. As Sandy alluded to, there are different types of support groups, and I've listed a few here. A lot can be peer facilitated, such as by a social worker or sometimes even physicians that are involved. I'm sorry, I got a little backwards here. By far and away, a lot of support groups are just patients only, and sometimes you have a veteran patient, so to speak, who can really guide the group. And then some are just completely informational types of support groups. And I think right now it's not absolutely concrete as to what groups and services are going to be offered, but I know as time goes on, that'll get honed down, and I'm sure at some point we're going to have a lot more informational type meetings available as well. Again, the different types of support groups, I won't read through this. I think that's pretty self-evident. And I put here, these are just some things that people need to ask about when they're thinking about getting involved in a particular support group. Who leads it? What's the format? Do I have to participate in the group? And who's attending it? How large is it? You won't find any of this that's going to happen in the support groups that are going to go on through this organization. You always have to be leery about groups that are designed to sell certain products or promote different types of unproven therapies and so forth, or charge high fees or something like that. I think this is very important also, caregivers. This actually was a very well done clinical study, observational study more or less, but it was done in a prospective fashion, meaning the investigators, they were determined to look at, as time goes on, what happens with caregivers, what happens with patients. Now, this was not caregivers and patients who necessarily went to support groups, but this jumped out at me. I thought this was very, very interesting. Over time, caregivers can suffer more symptoms of depression and anxiety than the patients can. And I think we don't think about that a lot. And I would bet you anything that that goes on and on. It may get better with time, I suppose, a little easier, but it never goes away. So I think that having groups for caregivers is critical to all of this. And on this topic, I will share also. My story is similar to Mr. Sharon's. I got the call the day, March 21st, 2003. My father had been having pain in the stomach, went to his doctor. I know the routine. Got some antacids, didn't get better, got sent to the surgeon, took his gallbladder out, pain didn't get better. Finally, someone did a CT scan. March 21st, 2003 was his 65th birthday. And on his birthday, he went to the gastroenterologist's office, who was out for the day, and the physician assistant sat down with him and my mother and told him he had a 5-centimeter mass in the mid portion of his pancreas. He called me right away, and I got him. He was 4.5 hours away. Got him out here. I was in my second to last year of cancer training at the Cleveland Clinic. I knew what was going to happen. And I don't mean to get too personal about it, but I remember the day I sat in Dr. Matthew Walsh's office with him, listening to Dr. Walsh say, "I'm sorry, sir, I can't help you with surgery." So I've been there. I've been on the caregiver end, and I can tell you, as a doctor, as an oncologist, I felt like a helpless idiot when it came to my father, who died 6 months to the day after his diagnosis. And yes, time makes it a little bit easier, but it never goes away. So I share that story only to bring home the point that for the caregivers out there, I think this organization is very key also. That's the last of my slides. And if there are any questions or any comments, I think it's fair to open it up if there are. But I want you to remember that the focus of tonight, the focus of the organization, is for patients and caregivers. So thank you all.